Thank you, everyone, for joining in. Today's Monday, June 1st. We have our press conference here. As you heard, we have a full panel. So we will ask that you please put your phones on mute. Unless you are asking a question, and even after you ask a question, please make sure to put it on mute so we can eliminate all the background noise. We will go ahead and get started with Dr. Monday.
Okay. Happy Monday, everyone. Hopefully everyone had a good weekend. So as of today, worldwide, there have been 6.2 million cases of COVID and 373,000 deaths. In the United States, 1.83 million cases and 106,000 deaths. In California, 110,583 cases and 4,213 deaths. In Imperial County, 1,634 cases and 27 deaths. I'm sure that everyone is aware that in addition to the fact that COVID is still going on, unfortunately, there have been some other pressing issues that have taken place around the country. And I would just like to say that we are very concerned, and our sympathies go out to the people who have been injured in any way from the activities that have been taking place. Obviously, this is a very sensitive and delicate matter, and we absolutely support the right of people to peacefully protest and speak their mind. But of course, we abhor violence wherever it occurs, and we certainly want to support everyone that's peacefully protesting. But of course, we don't want to see violence of any kind. So let me stop there and say that we did get a couple of questions in advance. So I'm going to start with those. The ones that I have are from Richard Brown from the Kxo Chronicle. And the first one is as follows. Can you clarify the status of COVID in the community in terms of where we rank in the state and nation and why? What is the direct relationship between Mexico or Mexican patients seeking care in our hospitals? So I will say that we remain the highest rate of hospitalization in the state. The most recent data for Imperial County show that we have a rate of 40.1 hospitalizations per 100,000 people, which was a 22% change. That does put us the highest rate in the state. Previously, when I reported on this, LA was number 2. They're actually number 3 now. The closest behind us is Kings County, and their rate is 17.8. In terms of what this has to do with Mexico, all I can say is what we have previously discussed, and that is that in northern Baja, that they are also undergoing a surge, and there are a lot of patients that are seeking treatment for COVID. Also, as we previously discussed, there's a very large population of American citizens or legal residents who reside in Baja and who choose to cross the border, either because they live on one side and work on the other, or because they need to seek medical care or other essential services. And because of that, there is ongoing involvement of the populations on both sides of the border. And again, this refers to people who legally are able to cross the border and legally able to access care. So they are absolutely free to seek care at the hospitals in our county if they so choose to do so. The next question says, can you clarify the situation being reported outside of Riverside County? They reported in a press release last week about some cases that were treated there. And then a specific question is, with regard to, was that the cumulative from cases that were first sent over after ECRMC diverted patients on May 18th or 19th, and is that continuing? So I'm going to defer that to our EMS team, which is Dr. Kathy Statz, our EMS director, and to Chris Herring, who is our EMS manager. So Dr. Statz or Chris, if you would like to speak, I would appreciate it.
Sure. So in terms of the reports that were provided out of Riverside County, that there had been some patients from Imperial County that had made their way to Riverside. That was based on the significant increase in volume of patients in Imperial County due to a surge in COVID cases. In order to meet the growing need within our two hospitals, these patients were transferred out to surrounding counties using our regional system. Since May 19th, we have transferred over 200 patients out of the county, and we do continue to see new cases within both hospitals. While this has slowed somewhat in the past few days, we do anticipate that transfers will continue to occur out of the county as long as we continue to see new cases entering Imperial County. However, we have confirmed there will be support to help in repatriation of these patients as they need it in returning to Imperial County if they are not able to get that from their own family or their own personal vehicles.
Thank you, Dr. Stats. The next question is, what is the status of testing? Are we being overrun? The first OptumServe site reportedly had a 2-week backlog. Is that happening everywhere? What's causing this? So in terms of the testing status, we are continuing to use our first OptumServe site. They are looking for rates of use of at least a daily average of 85% so that the testing is being fully utilized, and we have met that average. It was for that reason that we were able to procure a second site, which is supposedly going to be opening this week. It's just a matter of the logistics, obviously, so we'll confirm whether that's actually going to happen. Jeff Lamore, our Deputy Director for Environmental Health, who's been managing that process, will speak for that in just a second. But I wanted to say that that we are not being overrun. We are merely using our capacity to the maximum available. We continue to have some testing in the county. We are maxing that out in part because of supply allocations, as we previously discussed, but we continue to have the ability to send additional needed tests to San Diego County's Public Health Lab, and if it were necessary, to the state Public Health Lab as well. We're looking forward to getting the second OptumServe site because that will have 2 different locations separated by distance in the county, which will mean that people can more easily access it. They won't have to go so far to get the testing. And it also doubles the capacity on a daily basis from 132 to 264. And this allows pretty much anybody who would like to get tested to be able to do so. One of the reasons that we are so full is that we have tried to maximally utilize the OptumServe testing as well. For example, when we've had staff, say in a nursing facility, or perhaps some of our first responders or staff, say at the jail, and we wanted to get them tested, in part way we have done that is to arrange for appointments to occur at the OptumServe site. So we really are trying our best to make sure that we use this resource that the state has provided to us. Jeff, do you want to say anything specifically about just the particular logistics of getting the 2 sites going this week?
Sure. Thank you, Dr. Monday. Just real quick to clarify with regards to the comment of being 2 weeks out for appointments. And actually, I've been monitoring that fairly closely. We've been about a week out consistently for the last about week and a half. So that's pretty consistent even through to today. We do have the site already identified for the new site. It will be located at 247 South Imperial Avenue in the city of Imperial. It is the Veterans Hall. And that it will be up and operating at 10 a.m. on Wednesday, June the 3rd. So our new site will be, as I indicated, at the Veterans Hall operating on Wednesday. We've moved to a new location in Kxo, and that is up and operating as of this morning at 7 a.m. That is at the Kxo Community Center, and that's located at 707 Dual Avenue in Kxo. And just a comment with regards to that. With those who do schedule appointments, it's very, very important that they keep their appointment. We've had, although we're maxing out the scheduling each day for these tests, we are starting to see a number of no-shows. So we want to encourage the public, if they do schedule a test, that they keep that schedule in place so that we can make sure that everybody is getting an opportunity to be tested.
All right, Jeff, thanks very much. It's very helpful. And thanks for your work in that regard, because I know that's a lot of work to get those sites set up. So the final question that we received in advance has to do with the federal medical facility. And the question is, what kind of numbers are being seen to date at the IBC Federal Medical Facility? Is it true the facility is for people about to get out of quarantine? Is it a short-term facility? So again, I'm going to leave that to Dr. Statz and to Chris Herring to answer. So please go ahead.
Excellent. So we have a fantastic team at what was previously called the FMS, or the Field Medical Station. Actually, yesterday we updated that name to be more consistent with the naming that's been going on throughout the state as an ACS, or an alternate care site, because we want to be more representative of the care that we're able to provide the patients at that site. It has been open for 1 full week now, able to accept patients. We were able to open last Monday. We received our first patients last Tuesday. Since then, we have taken 7 patients to our ACS. Of those 7 so far, 3 have been able to be very successfully discharged from our facility, where they came in requiring some oxygen and were able to, after a day or 2 or a few days, walk out of the ACS without the need for any oxygen at all. We have also received some new providers to help assist with the ACS. And so we anticipate we will be able to increase the level of care and the number of patients that we will be able to take. In speaking with our partners throughout the state, we anticipate this will be one of the busier ACS sites due to the numbers of COVID that we are seeing within our county. In terms of facility for patients to be able to get out of quarantine, so currently, the patients that are coming to our facility are coming from the hospital, which means typically they are symptomatic, and so they would require potentially isolation as they have symptoms. The patients that would come to our facility to wait out their isolation would be patients that would potentially have high-risk family members or others they wouldn't want to expose at home. Other patients that our facility is able to care for are patients that have lower acuity complaints, but still potentially need some in-between time being treated at the hospital and going home. And so this is a good in-between location for them. It is absolutely intended to be short-term facility. It is typically costs on the ground in a gymnasium, just to sort of paint a picture of how it looks and the type of patients that would be appropriate to go there.
All right, Kathy, thanks very much. So that was all of the pre-received questions that we have. However, I do want to make one announcement that literally has just happened, and that is that we have updated our Roadmap to Recovery dashboard, which actually now shows the county's metrics on how we're doing. This is with regard to the fact, as you know, we, as a state, moved into stage 2, and then within stage 2, there was a plan put in place that allowed counties that met certain metrics to put in a plan to try to move through stage 2 a little bit more quickly. Imperial County has not been one of the ones who's been able to put out that variance document, but we have specific parameters that we need to meet, and we are doing our best to try to meet those, and we're keeping track of them, and we're wanting to share them with the public. So if you go to our the website with the Roadmap to Recovery, you'll now see the link that will actually show you the data and how we are doing. Just to share with you guys what's up there right now. So the first parameter that we need to meet has to do with epidemiologic stability, and there's 2 components to that. One is the 7-day average % change in hospitalizations. We're currently at minus 2.61%, which means that we have been able to discharge more than we've admitted with relationship to COVID. However, the 7-day average testing positive is almost 17%, Remember, our goal is to be less than 8. And so that means if we did 100 tests, that 8 or fewer of them should be positive, and we are at 17%. I don't find that surprising. We've expanded our testing, although we are trying to do a lot of testing of populations that aren't sick, but that might have risk of exposure. Again, our first responders, our healthcare workers, essential workers, people that work, say, in skilled nursing facilities, our populations that are isolated, for example, the prisons and jails. We are starting to focus on them more, but we still, of course, have people who have symptoms and are sick that are getting tested, and so our percentage remains high. In addition, we have to show that we can protect our essential workers, and that has to do with guidance documents. Much of that has been put out by CDC and by CDPH, and of course, we have that information readily available to those who need it. And we also have to make sure that we have appropriate supplies, things like PPE, personal protective gear, and disinfectants, and we have done that as well. The other, we talked a little bit earlier about testing, but the testing metric is important as well. And we have to show that we are doing a testing of a minimum of 1.5 per 1,000 residents per day. And since we are not quite at 200,000, obviously then that works out to be, 1 per 200,000 would be 200 plus another 100. So almost, so sorry, my math is, let's see, 1.5 for 200,000 would be about 300. But we just have to show that we can do that many per day. It's a capacity. It's not the number that we actually have to do. And since our population is a little smaller than 200,000, the number is actually less. And we have continued to increase our testing capacity even before we announced getting the second OptumServe site. As I had already noted to you previously, we were expanding the testing within the health department, and we were also able to use the San Diego Public Health Lab, and as I already noted, the state public health lab as well. So from a testing perspective, we're doing well. The other part of it is that at least 3/4 of the residents have to be within 60 minutes of a testing site. And between our hospitals, our clinics, our OptumServe sites, we have met that requirement. The other part is containment and hospital capacity, and that has to do with contact tracing staff, and that's 15 per 100,000, and we have met that, and we actually continue to add additional staffing in that regard. I've previously noted that the state has provided some resources, and we're taking advantage of that. We've also given additional training to some of our own staff, either within the health department or within the county in general, and so we have help. And then we need to be able to show that we have temporary housing units available for 15% of the county residents who are experiencing homelessness that could be affected by COVID, and social services does have a robust plan around that. The next part of that is the hospital capacity, and the hospitals have to be able to accommodate a minimum surge of 35% due to COVID-19, and they have plans in place to allow for that. And they also have to make sure they have enough personal protective equipment and other needed supplies to protect their employees, and they have done that as well. And then the last major parameter that we need to assess and to try to meet has to do with vulnerable populations. The first one is a bit more challenging. It has to do with skilled nursing facilities. And so they are supposed to have a 14-day staff of PPE on hand and an ongoing procurement process that doesn't require non-state or doesn't require state supply chains, meaning they have to have access to private PPE through the normal supply chains. That has been a little bit of a challenge because PPE is a bit in short supply. We are currently able to assist them to make sure they have what they need, and we're also trying to assist them in looking for other supply chains, so at some point they will be able to get these on their own. And then we have to have a plan in place and making sure that we're consulting with CDPH with regard to the skilled nursing facilities, and we have done that as well. So again, I just want to note that this is up on the Imperial County Roadmap to Recovery website, and we will be updating these parameters as we get the data. So let me stop there. I don't have anything else in specific that I wanted to share with you today. We do have a little bit of time, and so I'm willing to take a few additional questions.
Dr. Monday, this is Tom from the Imperial Valley Press. In terms of the testing capacity, can you clarify whether that's the amount of places where you get swabbed, or is this where they're doing the lab work?
So it's the actual ability to do the test. So it's the number of tests we can actually do. So we don't have any problems with swabs or the transport media. We have procured a really good supply of that. So it's the ability to get those swabs to an actual place where the test can get done. So with our first OptumServe site, that's 132 that we can do per day. So there's a large part of it. But remember, the hospitals also are testing people, and the public health lab does as well. And we have actually been focusing for the last month or so on our higher risk population, so the skilled nursing facilities, and that includes both the patients that are there as well as the staff, and also our jail, because we're very concerned in a contained population like that we try to protect both the inmates, but also the staff. And so since we have, now are going to have a second, but have had the one OptumServe site, we've got the 2 hospitals that are testing. We have private people testing as well. And the health department has significant internal, but even more so external capacity, because we can send the tests out, then we do meet the testing capacity. But it is the actual ability to do the tests themselves.
Gotcha. As far as the other question I had is, in terms of the, I know we've seen spikes after Mother's Day and Easter. Are we seeing any evidence that there might be a spike following Memorial Day weekend?
So it's hard to say specifically, with regard to Memorial Day weekend for a couple of reasons. The first thing is, remember, the incubation period for this disease can be as long as 14 days. So you really need to have at least a couple of weeks of data, and then there's obviously a delay in the reporting, because by the time you get the testing done and you get the results back. So there's always going to be a lag in terms of that. The other issue is that because we are in the midst of our surge, it's hard to know what one specific factor might be contributing. But we are collecting the data, and of course, once we get out a little bit, another week or so, and we've managed to collect all the data and analyze it, we'll have a better idea. But it's hard to say for certain right now. But of course, it is something we were concerned about, and it's why we tried to share a lot of information with the public before the weekend, to ask people to continue to follow the social distancing guidelines and not to mingle with people outside of their immediate household.
Okay, thank you.
You're welcome.
Hello. Hi, I'm Junella with KYMA. I actually do have a question. Can you talk a little bit about, just the vulnerable communities here? You mentioned the homeless, you mentioned the inmates, people of color. Can you just talk a little bit more about how they're being affected?
So in our county, I think the bottom line is that because we're a small community, that virtually everyone here is affected. Specifically, though, if you look, just to focus on a couple of them, like everywhere else in the country, the skilled nursing facilities have been a place of great concern, and where many of the cases have occurred. And because they are the highest risk populations, they also potentially could have the worst outcome. And so we have actually focused on them for a long time, but more recently, now that we have had some cases, we have focused on them even more. And so we have had a few cases in the skilled nursing facilities. We've actually gotten some extra help from the state with regard to responding to that. We're aggressively testing people who are going into the facilities, and that includes both the people that work there as well as the patients. We're trying to make sure that they're following appropriate social distancing and other isolation precautions to make sure that there's not intermingling, and so that there's much less likelihood that it would be spread from person to person. Similarly, if you look at the jail, it's the same kind of a thing. There's two separate populations to be concerned about there. One is the jail population. In particular, obviously, if they're going to be there for an extended period of time, then there's the risk of that they could get exposed over time. But we also have to worry about the people that work there, our officers and other staff. They are actually members of our community. So they potentially can get exposed in the community, or they could potentially get exposed, obviously, in the jail if there's somebody there who's COVID positive. So we've really focused on them. As I mentioned earlier, one of the things we tried to do was to really utilize that OptumServe site is to schedule blocks of time and send people in these high-risk populations to OptumServe to get testing done. And we're doing more of that. We continue to identify similar populations. We've also had some small populations of people experiencing homelessness. Social services manages their needs in terms of any kind of wraparound services that they need, but we're assisting with the testing. And so we are trying to identify populations to make sure that if they do need to get tested, that we facilitate that process. I previously noted that, and I don't know if you've been on any of these conferences previously, but we have had, before we had our FMS, one of the challenges that we had in the county was what to do with someone who needed to be discharged from the hospital but didn't have any place to go. And we have had some small places to put them available. For example, we have a TB housing that we normally use, obviously, for tuberculosis at the health department that somebody who doesn't really require, medical care could potentially stay at. So if it's somebody who just needs a place to stay and they don't have a place, that was something we could use. We've also got these trailers that were given to us by FEMA. Jeff Lamore, again, our Deputy Director for Environmental Health, can talk more about that if you have more questions because he managed that process. But we have identified the resources that we need to try to help these various populations, and we are focused on trying to make sure that they get tested appropriately and that they get what they need.
Okay, I have another question. Do you know the current number of the inmates and just the jail staff that have tested positive?
So if you have specific questions about the jail, since you didn't ask me in advance, I probably don't have the numbers in front of me because we do them in cycles, and so I don't think I probably have the total number of positives in front of me. So I will get somebody from my epidemiology staff to look at the numbers and add them up, and they can supply you with the number.
Okay, thank you.
Welcome.
Yes, this is Richard at the Clarksville Chronicle. That was the question I was going to ask too, since there is a concentration on the vulnerable populations right now. Is there any way to get the latest statistics or data on these three groups, homeless, skilled nursing, and jail, both inpatients and staff?
I'll have to make sure, of course, that we respect everybody's privacy. So I'll have to look at that in that regard. But yes, the bottom line is that if we have the data and we can share it with you, we're more than happy to do so. We do it for example, the skilled nursing facilities. We can do it in terms of total numbers, not individual facilities. Obviously, if the state has published numbers, you're free to look at those.
Okay, thank you. I just wanted to see the local numbers for those vulnerable populations, though.
No, but I'm just saying licensing and certification at the state obviously might have some numbers that you would find helpful as well.
Oh, thank you. Appreciate that. Thank you.
Any other questions?
This is Tom again at the Ivy Press. I did have a question I put out there last week that I didn't really get answered. As far as the new testing site, I was trying to understand the logic of pulling a site out of Imperial, moving it to Kxo, and then putting another site in Imperial. What was the reasoning behind that?
I'll let Jeff answer that, but the bottom line is we were already planning to move the site before they approved us for a second site. So two things kind of happened simultaneously, but I'll let Jeff answer that because he can explain that better than I can.
Thank you, Dr. Mundy. And Dr. Mundy, his response is correct. We submitted our request not only to cite a new facility in Kxo, but also we requested an additional site, and that was done on the 19th of May. We got the approval about 3 to 4 days, about 4 days later, with regards to the move to the new site, and we continue to press for the second testing site. We didn't receive that approval till late last week, so the movement was already in motion. We already had residents already scheduled, were being scheduled at the Kxo testing site, so we didn't want to disrupt that. So we went ahead and went forward with the move. We actually moved the site over the weekend. We moved it on Saturday with the intent of having it up and operating on Sunday. At the same time, on Thursday, we were able to secure the new site, put everything in motion with regards to, or on Wednesday, I'm sorry, got everything in motion with regards to that, and that is scheduled to open up on as I mentioned earlier, on June the 3rd, which is this coming Wednesday. It was all merely logistics, is how that played out.
Okay, thank you.
Hi, this is Alex with KYMA News. My question is regarding the cases across the border. I know that the mayor was in town on the 21st of May, and I spoke to her, and she had said that there was still room in their hospitals. The following day, on Friday, 22nd of May, that evening, she took out a press release or a video actually saying that their hospitals were maxed out. Do we know what's the current situation over there? And as well as, is there a plan to possibly transfer patients over there to be treated here? Just so
I'm sorry, which mayor are you talking about?
The mayor of Mexicali.
So I'm sorry, if you have questions about Mexicali, you're going to have to follow up with them. I don't have any comments in that regard. But other than I can just tell you that we directly transferring a patient from here to Mexicali would be something that would be done if it were being considered through the EMS system. So Dr. Stats might have a comment in that regard, but other than that, I can't make any comments about what the Mexicali mayor said because I didn't hear it. So, Kathy, any comments in that regard?
So to confirm, the question is, would we transfer patients from hospitals in the U.S., either Pioneers or El Centro, to hospitals in Mexicali?
I mean, is there any plan to work together, in other words? Because basically they had met that week, or I mean, there's talks that you guys are in constant communication and, you know, kind of helping each other out. What is the situation?
Sure. So we do have a representative from Mexicali on our daily EOC calls to give us an update of the situation. However, it is changing very rapidly, and some numbers are proprietary. I think Chris Herring would be able to speak to the resources, but we do want to help our colleagues in Mexicali. They have requested resources, and we have forwarded those to our state partners, and I think Chris can speak more on that.
Hi, so Chris Herring, Imperial County. We addressed the question as far as resources transferring patients. So we don't have the ability to directly transfer patients hospital to hospital across the border. So generally what happens is these are going to be U.S. citizens or legal residents who are arranging for transportation from the hospital, privately paid ambulance from the Mexico side, and they arrive into our healthcare system as a 911 call at the port of entry. Those patients are assessed by our local EMS providers and transported to an appropriate hospital on their condition. So they're not set up as inter-facility transfers. As far as resources and sharing resources across the border, as that's mentioned, the request from Mexicali has been forwarded to a couple of different state agencies who are working with federal partners to try and address some of those resource needs. Unfortunately, it has to happen at that federal and state level through the appropriate. Currently, we're still locally to fill the needs of our healthcare providers. We don't have the ability locally to directly assist them at this time, but we have been sharing that information with our state and federal partners and advocating for
for assistance to that jurisdiction, to the Mexicali as well.
Okay, thank you.
Mr. Herring and Dr. Statz, this is Richard from the Kxo Chronicle. Along those lines of what was just asked, the Riverside Press Enterprise a couple days ago published a story when they initially used the information coming from Riverside County government on the number of cases from Mexico. There was a passage in that original story that referenced unsubstantiated claims of airlifts from Mexico of COVID-positive patients into facilities in California, whether it be Riverside County or other counties. Have you heard of anything like that, any of those unsubstantiated rumors or reports of that? Since it did appear in a pretty reputable newspaper, I'm just wondering what if you had seen that or heard anything about that.
So this is Chris Herring, and I'll address that. So I have not seen or heard or been able to verify any direct air transport from those healthcare facilities or healthcare system to any hospital.
And this is Dr. Statz. There may be confusion potentially, and a potential situation that could have occurred is if there is an American citizen or a legal resident that crosses at the port of entry, appears very ill medically, and would potentially require a very high level of care. Those patients are often evaluated. These American citizens and legal residents that cross at the port of entry, they're evaluated by the U.S. EMS system in Imperial, and if it is deemed that it would benefit them to be flown to a nearby tertiary care center, that occurs. But that occurs north of the port of entry within Imperial County limits. So I can't speak to if that could potentially be the source of that story.
Thank you.
All right, any other questions? We're kind of beyond our time here, but we could probably take one more. All right, then, well, thank you very much. And everyone, please stay safe. And as always, I would ask that you continue to physically distance yourselves and keep your hands washed, and have a wonderful day, and thanks very much. Bye.
Thank you. Bye.